yeah, you can go on to chair the session.
All right. Thank you. Thank you very much, Professor Olivier. I think my system conspired not to allow me the honor to invite you. I think it just realized you my co-chair for the various sessions. Professor Olivier, now that we have talked about the vaccine, I have found out currently here, if we have the Terraria vaccine, if you want to vaccinate one animal, it is actually impossible. You must vaccinate at least 100 at a go. So what is your take on the cost of the vaccine in this case? Thank you.
Gosh, that's a difficult question because what I remember from the Teleria parva vaccine in Kenya was it was a live vaccine, and that will depend on what vaccines we are using. And that could be the problem because there are pros and cons to use a live vaccine. The live vaccine will allow the immune system of the patient or the animal to face the pathogens for a longer time, and so to develop a more robust immune reactions. But the problem with a live vaccine is that you introduce the pathogens in your patient or your animals. And in this case, like we did in Kenya, we were injecting Teleria parva alive into the animals. So you can imagine that, as you said, if I only vaccinate one of the 10 cows and we still use drugs to make sure the Teleria parva was not multiplying too much in the cow, so it gives time to the cow, but we were not doing anything for the other cows. So as you said, if there is a tick feeding on my vaccinated animal, it's picking Teleria parva, doesn't get the drugs that the vaccinated cow was receiving to protect her, and this tick is now taking a Teleria parva from the farm and spread it to the rest of the farm by biting the other animals. So as you said, we work with this kind of live vaccine and introduce a pathogen in the farm. I think you have to vaccinate all the animals in the farms, or you take the risk that you only vaccinate some, and now you expose and take the risk that you introduce the pathogens in the farm, and those not vaccinated can be at risk that some ticks will pass these pathogens that was not there in the first place. And what we know with the live vaccine is that you have to be extremely careful how you balance the pathogens and the drugs to make sure if the drug is too strong, the pathogens will die and not proliferate, and then the immune system doesn't see anything. If the drug is not strong enough, then the pathogen is now surviving, proliferating, and the animal has no time to develop the immunity and they start to be sick. So I think what I see is that now people prefer to go into more recombinant and genetic vaccines because it doesn't bring these live pathogens into the farm. Having said that, and we have seen that with the tick vaccine, you have to be extremely careful. And we had this discussion with other colleagues here in the room, is that the pathogens you are picking in Kenya, we hope it's the same, the antigen and the protein you pick in Kenya, you hope it's the same protein that we have in the same ticks in Hong Kong, in Pakistan, or in Trinidad and Tobago. And we have seen with the tick vaccine that unfortunately, the BM86, 91, and 95 proteins were not worldwide prevalent in other countries. And unfortunately, the vaccine in Australia worked only in Australia because the ticks in South America didn't have this protein. They had mutated. They were the same species, but nevertheless, the vaccine was not recognizing the protein that had mutated in ticks from other countries. So once again, if somebody wants to put a tick vaccine on the market, make sure that whatever you target in terms of protein is going to be a protein that exists in all the ticks in all the countries, so you can sell your vaccine to every country and not just yours where you have been testing the vaccine. So so many companies, I'm very surprised there's still no vaccine on the market. Thanks for the question.
I was asking about the uptake of the vaccine. Now that we have seen apathy even in human vaccine, what do you see the future of the vaccine in the control of neglected diseases? Thank you.
Oh, gosh, if I knew the answer, I would be a rich man, but I'm not, I don't know the answer. But as we have seen, my worry is that when we are vaccinating against one disease, it doesn't prevent your patient to die from others. And that is why maybe a few years ago, a few decades, people decided to develop a mosquito vaccine, a tick vaccine, because they thought by eradicating and knocking down the ticks and the mosquitoes, you eradicate all the diseases they are carrying. If I just stop Teleria, I'm not going to prevent my cow to die from Ehrlichia, Anaplasma, and other viruses. So in a way, you could say, you were mentioning about the cost effectiveness. I guess it depends in which country we are working, where we know what is endemic and how many diseases are around, because now, if I was working in Kenya, I will not recommend a Teleria vaccine. I will recommend an anti-tick vaccines to make sure I remove the Anaplasma, the Ehrlichia, the Teleria, and the things that, like the Nairobi sheep disease, where in fact it's a toxin, but the toxin is because of the tick bite. So I could kill my Teleria, but your sheep still get the Nairobi sheep disease and they die of it. So I will go for the vector now. I will go for an anti-vector. If I stop one disease, it's maybe not enough now.
Thank you for the response. Let's hear the question from Lydia. Lydia, you're welcome.
Thank you, Josephine.
Kindly unmute.
Yeah. Thank you, Olivier, for a very exciting presentation. I just want to ask if these ticks are developing resistance to acaricides, the presently used acaricides.
Absolutely. I mean, we have done that with other countries in Europe, and we have seen a lot of acaricide resistance, and for different reasons. And although I know the talk is recorded, I have to be extremely careful what I'm going to say, because it could be on Twitter and YouTube tomorrow. So we know that in some countries there is a lack of drugs to be used against ticks and tick-borne diseases. And if you are a medic and a veterinarian in some countries and you face your patients being affected and dying, sometimes you have no other choice than to try other drugs that are maybe not licensed for what they are licensed in your country. And I know sometimes practitioners have no other options that to try other drugs that they think maybe if it works on the mites, maybe it will work on the ticks. If it works on the mosquitoes, maybe, but they have no proper tick license for this kind of drugs. So they have to try other things. And that is why sometimes we have this resistance, because we can't use what we want to use. But the other thing I've seen is that sometimes we need also to educate the general public and the farmers, because I have seen many times farmers trying to dilute the drugs we give them because they think it's cheaper. And if I can dilute the drugs, then I can use it on a longer term and it costs me less. But in fact, you're just exposing your ticks or your mosquitoes or your parasite or your virus to a lower dose, and you give them time to adapt to these lower doses. And in this case, you create the resistance on your own farms and in your own family by not following the guidelines of what are the real dose that will eradicate and kill these ectoparasite or endoparasite. So sometimes I see the problem of resistance is created by ourselves and the farmers and the vet and the medics and ourselves not using the right dose and exposing these pathogens to lower dose. That's not good. It gives them time to adapt. And we don't want that. We need to kill fast.
Thank you, Olivier.
Thank you very much for that response, Professor Olivier and Lydia, for the question. Do we have any other question? You can unmute and ask. I cannot see any raised hand for now.